Hello friends, welcome again to your own YouTube channel Ask Your Gynecologist. I am Dr. Sonal Parihar. So today again I have come up with a topic which has been requested by many people. Last time we discussed about thyroid disease in pregnancy. This time we're going to discuss about diabetes in pregnancy, that is gestational diabetes. Now everybody knows why diabetes happens. Diabetes happens when the balance between your hormone, the insulin, which gets secreted from the pancreas, which is a gland inside, the balance between insulin and sugar is lost. The sugar rises in your blood. You suddenly have all those symptoms of diabetes, which are like many symptoms. Your organs start getting affected. You start feeling weak, and then you start passing sugar in your urine. That means your kidney is not able to balance the amount of sugar in your blood. So that is called diabetes. We will not go into the details because that is more of a medicinal topic. Now I just tell you that there are two types of diabetes. One is insulin dependent diabetes mellitus, which is a kind of congenital diabetes which develops when you are born, and it may be familial, generally familial. Family history is there, or you are born to a mother who was diabetic, so you have acquired that from her, and then from the very beginning it's a congenital diabetes. You need insulin, so it's an insulin dependent. That means your body is not producing enough insulin, so you need to have insulin injections daily. The other one is more of a lifestyle diabetes which develops later. It's an adult onset diabetes. It is called non-insulin dependent diabetes mellitus. Why non-insulin dependent? Because the insulin in your body is fine, your pancreas is functioning fine, but it is your lifestyle factor. You become obese, you're not working out, you're not spending your calories, you are eating all junk food and lots of stress. So all these things, they lead to all the lifestyle problems which I told you last time: thyroid, diabetes, high blood pressure, obesity. So this is again one of the lifestyle problems, and this develops in the adult when you are an adult, and it is generally non-insulin dependent. If it is not controlled with tablets, then sometimes you might have to switch over to insulin. So these are the two types of diabetes we generally have. Now, what happens during pregnancy? During pregnancy, as I told you, there are certain hormonal changes from the placenta. There are certain hormones and certain hormones in your own body which go up and down, which are very important for your baby. So again, diabetes develops in patients who are pregnant because it is a diabetogenic condition. Your placenta secretes certain hormones which interfere in the metabolism of sugar and insulin. So there is a disbalance between these two. Insulin goes low, sugar goes high. So patients who are not probably unhealthy, I would say, who are not having the risk factors, they will be able to overcome that. So it is a diabetogenic condition everyone goes through. That is why everyone goes through the blood sugar test in the first trimester. As soon as you book yourself, then you have that glucose challenge test, glucose tolerance test in the 7th month, 6 to 7 months, just to check that your body is able to tolerate the sugar, the challenge that we are giving, and then again in the 3rd trimester, because these are the 3 trimesters when the body is going lots of changes in the hormones. So every patient goes through that, but the ones who are at risk, they will have more screening and they might develop gestational diabetes because their body is not strong enough to accept and to overcome the challenge of the placental hormones. So in pregnancy, it is very common to develop gestational diabetes. Now, what are the risk factors? Who are at risk? The women who are obese from the very beginning. Now it is very difficult to define what kind of weight you should be having. So please don't ask me that, ma'am, I'm 50 kgs, is it okay? Please don't ask me that. Buy a weight and height chart, because that exactly tells you what is your BMI, and the BMI has to be within normal limits when you are pregnant. If you are having a higher BMI, your doctor will tell you that at the booking like blood pressure and weight checkup, you will be told that you're already overweight. So please be careful about your weight, because you're going to gain anyway 10 to 15 kgs during your pregnancy. That's normal. Not less than 10, not more than 15. So I would say 10 to 15 is normal. Okay, so just keep a check on your weight when you get pregnant. So the first risk factor will be high BMI, that is an obese patient. Now, second risk factor would be a person who is suffering from some kind of ailment, some diseases which make her more prone towards diabetes. We discussed PCOD. We discussed it in 4 parts, 4 different videos were released. So PCOD makes you diabetogenic because in that case your body is resistant to insulin. So again, if you are a PCOD patient and you have conceived, then your doctor will ask you to get your sugar checked more frequently as compared to a patient who is not a PCOD patient, right? Third risk factor would be your age. If you are above 30 or say 35, as you like kind of increase in your age, your tendency to develop high blood pressure, diabetes and other problems increases, because pregnancy itself is a stressful condition. You tend to have a lot of hormonal changes, and as you get old, then obviously your body cannot tolerate that. So more the age, more chances of developing diabetes. Then comes family history. If you have a family history, you will definitely be asked more frequently to come for sugar checkup, because as you know, when you book yourself, your entire family history, mother, father, brother, sister, everything we write down, and we make a note that you are more at risk to develop gestational diabetes. Then comes your own history. In your previous pregnancy, if you have had gestational diabetes, then of course in this pregnancy also you will be having more risk factors as compared to a woman who has never either had a pregnancy or never had gestational diabetes before. So you are more at risk. Okay. The sixth risk factor, I would say, would be a rapid weight gain during pregnancy. Now, as I told you, in the initial 3 months, that is the first trimester, you are not supposed to gain more than 2 to 3 kgs. Then comes the growth spurt in the second trimester when the baby is growing. Then you kind of gain around 2 to 3 kgs per month. So if you are gaining more than that, please visit your doctor, because your entire weight gain during pregnancy should not exceed 15 kgs. So if you are growing rapidly, that means there is something wrong. Either you are eating unhealthy food, you are not working out, spending your calories, so you have to be careful. So a rapid weight gain will obviously set the alarm that there is some problem, either gestational diabetes or high blood pressure or some other problem, right? Now, how to overcome these, how to prevent this happening? Well, as I said, first of all, have a proper diet schedule. Please eat healthy. As I told you in my previous video, what not to eat and what to eat during pregnancy. So please eat healthy. Include a lot of fiber in your food so that you get rid of the constipation. You get rid of all the other ailments which develop because of all this junky food that we have. So please do not stick to junk food. If you like junk food, then you can probably make it like a 1 cheat day per week or 1 cheat day in a month. It depends upon you. So eat healthy. You should have a balanced vitamin, mineral, carbohydrate, fat, protein in your plate. And you should not have lots of like fatty foods and sugary and refined sugars and refined flour. Please avoid that. The confectionaries, the cookies, please avoid that. Okay. Secondly, working out. Now I'll be making very soon a video on what all kind of exercises and yoga is possible to do in pregnancy, and it is good for you. So please work out. Please do brisk walking. Swimming is very good for you. So these things will help you stay healthy and digest your food, whatever you are eating. Even if you have had a junk food like a binge someday, then you can always fight that with your exercises, right? Thirdly, keep a check on your weight. Your doctor will weigh you every month, but then you have to weigh yourself. If you think you are kind of getting tight in your clothes, please keep weighing yourself. You have to keep a check on the amount of weight you are gaining. As I told, you should not gain too much weight, not more than 3 kgs per month. Okay. Next is keep a check on the kind of like the amount of food you are eating. Divide your food, divide your meals into like 6 to 7 times a day. Rather than having 3 big meals a day, have 6 to 7 small meals a day, because that will help your body to digest food better. Your digestive enzymes, your insulin, all the hormones which are responsible for digestion, they will keep getting secreted every 2 to 3 hours. So you'll feel healthy, you'll feel less full, and you'll be like ready for your next meal. So you'll feel better, more energetic. Okay. So this is all you can do to stay healthy and avoid diabetes and avoid other stressful situations as well, like any kind of stress. You know what all kind of stresses you are going through in your life. So any stressful condition in your life will definitely make you more prone towards high blood pressure, diabetes, thyroid and blah blah blah. Okay. Now what are the symptoms? Now you cannot just rely on the blood sugar test that your doctor is doing. You have to know what all symptoms can actually point towards diabetes. First is feeling extremely thirsty. Now extremely thirsty, obviously it is very common when you are pregnant, you have a baby growing inside you, your metabolism is high, you will feel thirsty, especially if you are like living in a very hot and humid sort of climate. But still, if you feel that this is not normal for me, it's too much thirst and too much dryness in the mouth, then you have to get your blood sugar checked. It's an alarming situation. Then if you pass lots of urine, well, passing lots of urine may not just be diabetes. It may be because of some infection. It may be because you're drinking lots of water, you're feeling thirsty. It may be because in the first trimester, the first 3 months, the uterus is growing, and just in the front of the uterus there is a bladder. So uterus presses on the bladder, and that is very common to have a increased frequency of urination in the first 3 months. So avoid all these three factors, and even in spite of this, if you feel you're feeling like you need to go to the toilet every now and then you get yourself checked. That might be high sugar. Okay, then the other symptom might be lots of weakness. Well, weakness is common in pregnancy, but if your hemoglobin is normal and you're eating well, no vomiting, you're sleeping well, no hard exercise and all, still you're feeling very weak, then you should get yourself checked that it might be something like thyroid, it might be diabetes. So you have to keep a check on all this, right? Sometimes your eyes might start blurring. Now, blurring of vision in pregnancy, it can be alarming, it can be high blood pressure, it can be a pointer that you are developing preeclampsia, it can be just your number, the specs that you are using, it might be increasing, because it is very common in pregnancy to develop all these problems, and what all problems you were having before pregnancy, they might increase. So get your number checked. In spite of that, if you still feel there is blurring, do keep a check on your sugar, because the patients who are diabetic, they would know that diabetes, it basically affects all your organs, including the retina of your eye. So retinopathy might develop for patients who have not been careful, who have not had a proper antenatal checkup and sugar checkup. Okay, the last symptom that might point towards diabetes would be infection. Now, infection, as you know, in diabetes is very common, because your immunity as such decreases when you are pregnant, and diabetic patients, even those who are not pregnant, they would know that your wound healing, even if you had a surgery, everything is delayed during diabetes. You might have pus, you might have infection in the skin scars. So as I said before, in vaginal infections, fungal infection is very common, and fungus, it grows, the candida, it grows where the moisture is more and whenever the body is less immune. So pregnancy along with diabetes make you more prone towards fungal infections. Vaginal infections, recurrent vaginal infections are common, recurrent urine infections are common, itching, burning, all these are very common in diabetes. Okay, so I think guys, this is all for today. We have discussed what are the kind of diabetes, the two types of diabetes, why in pregnancy the ladies are more prone towards diabetes, what are the risk factors, who are the ladies who will develop more gestational diabetes as compared to the other ones, what are the preventive factors, what you can do, and what all symptoms you can expect, right? So in the next video, we're going to discuss what is the bad effect of diabetes on pregnancy, on mother, on the baby inside the uterus, and what happens once the baby is out. How do we monitor the baby and the mother? Okay, so till then, do subscribe to my channel. Please do subscribe. I know you are all liking my videos, you're viewing them, but viewing is different and subscribing is different, because subscriptions make me happy, and obviously you get the notifications which you might sometimes miss if you have not subscribed. So do tell your friends and relatives. You can also follow me on my Instagram handle, sonal.parihar.33. Till then, take care. I'll be back again very soon with the next part of this video. Bye bye.